Promising to be an excruciating debate in our nation's capital. Republicans now in control, promising to repeal Obamacare because of high premiums and a lack of competition in the marketplace. President-elect Trump, in fact, calling Obamacare a disaster. Meanwhile, President Obama and Democrats are asking for restraint and minor changes to the Affordable Care Act. And feeling stuck in the middle, the medical community bracing once again for insurance upheaval. And joining me right now is Dr. David Emmel, an ophthalmologist with the Connecticut State Medical Society. Thank you so much for taking the time to talk with us.
Jen, thank you for having me on the show.
Of course. All right, this is a complicated issue, of course. But let's start with your view as a healthcare provider. Do you want to see Obamacare repealed?
Well, Jen, one of the things that is most troubling to physicians is when we see patients come in and we know that we can help them or we could have helped them and they don't have the resources, especially when it's insurance resources. And so when we have a plan like Obamacare, which is making quality health care more available to people, we're always very anxious and nervous when changes in the future. Plus, it has taken a while for all physicians to kind of gear up to all the changes we've already experienced, and now we're once again facing new changes and wondering how that's going to impact our ability to deliver accessible, high-quality care.
Yeah, Obamacare was signed into law 2010, and then there was a ramp-up, right, while everyone prepared for it, including a change in computer systems, everything like that.
That's correct. I don't know exactly what we'll get. It's fascinating to watch. I don't anticipate anything will happen awfully quickly. I think there are a lot of people that are very fearful, but I think we're going to see the change come slowly. Some change is necessary. I mean, the Obamacare is not a perfect law. It doesn't cover everybody, and there are issues that are making it less accessible for people, especially as they find themselves in high deductible plans that make it very difficult. We're beginning to see people who defer treatment, defer visits to doctors simply because they have a high deductible and they're fearful that they're going to be stuck with a high bill.
Yeah, would you say that's the most common complaint from people, from patients about Obamacare?
Absolutely. On the front lines, yes, that's the sort of thing that troubles people the most.
And what about healthcare providers? Is it that you're worried patients can't get access to the health care that they need?
Yes, I mean,
because of affordability?
Because of affordability, and it impacts our ability to just give the kind of care we want to give, to have continuity of care. I saw a patient recently who was with me, lost their insurance, finally got insurance and came back. 5-year gap, had severe glaucoma develop in between and has lost vision. That could have been prevented.
Were there positives from Obamacare?
Yes, absolutely.
Pre-existing conditions, I would assume,
getting rid of pre-existing conditions. The limits on lifetime and annual. Giving access to 200,000 people in Connecticut who were not covered, who were able to enroll in Medicaid. We're very concerned about what the block grants will do, whether those folks will continue to be able to have access to health care insurance.
So you're hoping there is some kind of compromise reached where it's not just pulled out from under everyone. Yeah. Some of the positives are kept, some of the negatives dealt with.
We hope there are sane minds in Washington thinking about these things.
All right. Dr. Emmel with the Connecticut State Medical Society, thank you so much for your insight.